I am Dr. Vinoy Upadhyay. I am the consultant orthopedic surgeon in the Hope Hospital, Greater Noida. I deal with joint replacement surgery, sports injury, and spine surgeries. Today, as we know, that the National Nutrition Week starts from 1st September to 7th September. So I will take this opportunity to introduce few important elements of nutrients which are very important for us in day-to-day activities, as well as to each and every of us in of whatever age we are. So let's start with the vitamin D, as it's which we consider that that's the most important nutrients, not only for the bone health but also for many of these immunity related things. As you know that vitamin D is a very important vitamin that helps in absorptions of calcium. It's a vitamin that helps in bone mineral density maintenance. Also in supravital doses, it helps in immunity related things as well. As you know that with most of these corona cases that has been happening, the research has found that the high doses of vitamin D is really very important in getting you immunity against the the protection against corona. So that we have found. So we have been prescribing supravital doses of vitamin D. That means normal than the excess doses of vitamin D, and that has really saved life in many of the cases. So to begin with, as you know, as right from your childhood and as you grow as adults, your bone stock develops, and as you grow old, so in different phases of life, the requirements of vitamin D varies accordingly. So coming to this thing, how you get what are the sources of vitamin D? So vitamin D has generally the animal sources. So it's take plenty of eggs, the like fortified milks. You get that vitamin rich sources are there. The liver of the, for example, what we call as in Hindi, what we call as kaleji of these, chicken, the meat sources, they provide the high density of vitamin D. The fishes, they also are the more important finds of vitamin D. Limited doses of some fortified oils and all, they also provide these kind of things to help in maintenance of bone density and everything. Now, as we have been discussing that how to use it, like whenever you are using vitamin D in your day-to-day activities, in infants, the requirements, because as this is the bone formative age, so you need lots of vitamin D because the bone stocks develops, and over a period of time when you grow in the childhood phase, when there is a adolescent growth spurts phase, whether in male or female, or when you are in the phase of during pregnancy, because the kids and they develop, they retain the calcium, the formation of bone occurs. Also during the lactation period, you require the most of the times you require lots of calcium, because the mother's milk provides the lots of calcium to the baby, and the bone health depends majoritarily, especially during intrauterine phase, and also after the immediate postnatal period, you require lots of calcium for the development of the baby's skeleton. As the baby grows also, that is over a period of time, you require lots of calcium, because vitamin D helps in formation, because many of the patients develop the rickets, what we call as rickets. Rickets is called like bowing of the leg, where this bowing is inside or outside. So what we call as physiological genu varum or genu valgum. If you go over a period of time, for example, in adults, you have osteomalacia, or you get some chondrological fissuring, so that causes very severe pain. And as you grow older, especially in females, like especially in postmenopausal cases, like after the stoppage of the menstrual cycle, the sudden stoppage of these the hormonal support to the bone, that decreases the level of calcium, and the risk of fracture, what we call as fragility fracture, that increases dramatically in these strata of patients. So senile osteoporosis, or what we call as postmenopausal osteoporosis. So the risk of fracture, for example, they fracture at the lower end of the radius bone or the neck of the femur bone, or especially in the spine, this increases rapidly. So in these cases we should provide regular, but the WHO has recommended that should be given a regular amount of calcium over a period of time. So that is very, very important for the maintenance of the bone mineral density, as well as to maintain the positive bone health. So this is the one aspect, and also it has been found that not only it helps in the positive health bone health maintenance, but also it provides protection. It acts as antioxidants, as well as it provides over a period of time protection from many of these cancers and many deadly diseases as well. So I hope that with this lecture you'll try to benefit from these steps and take your bone health really seriously. Thank you very much.